Thank you for joining us. My name is Jennifer Peters. I work for the Arizona Center for Rural Health and would like to wish everybody a very happy National Rural Health Day today. Every day is Rural Health Day in our space, but there is one day out of the year where it's really nice to see all of the messages and accolades really come to the forefront that celebrate the work that everyone does for the betterment of rural communities across the country. So with that, let's get started with our webinar today. So as usual, I'm very pleased to welcome you to our Center for Rural Health webinar series, which would not be possible without the support of our partners at the Arizona Telemedicine Program and Southwest Telehealth Resource Center. And just a few housekeeping items. The audience is muted during the presentation, but you may enter questions into the chat box throughout the webinar. There will be a survey that comes up at the end, and we'd appreciate you answering that. And the webinar will be recorded, and the recordings posted on our Arizona Center for Rural Health website, as well as the Southwest TRC. So today, National Rural Health Day, we are going to be hearing from our good partners at the Arizona Primary Care Office, which is located at our state health department, on HPSAs, or Health Professional Shortage Areas, and the Loan Repayment Program. And I'm very pleased that we are joined by Tracy Lenartz today. Tracy has been working with the Arizona Department of Health Services for many years, probably close to 15 years, right, Tracy? And she coordinates Arizona's shortage designation programs and assists with all sorts of health planning, data, and training around issues related to access to care for Arizona's underserved and rural communities. And we're also joined by Edith DeSanto. Edith is the chief for the Primary Care Office at Arizona Department of Health Services. And the Primary Care Office is an essential point of contact in every state. It oversees workforce programs that are aimed at increasing access to primary care, and with an emphasis on health needs of that should be underserved people and areas. Edith has a master's degree in public health focused in health policy from George Washington University, and over 13 years of public health experience. Next slide. And with that, let me turn this over to the capable hands of Tracy Lenartz.
Thanks so much, Jen. Good afternoon, everybody, and thanks for joining us today. We always love an opportunity to share the information about what our primary care office does to our partners across the state, especially those in rural areas and other underserved areas. So as Jen mentioned, we are the primary care office for the state of Arizona, and we're located within the Bureau of Women and Children's Health at the Arizona Department of Health Services. This is a HRSA-funded cooperative agreement, the primary care office. So we're just kind of a small office within the big health department. And our goal really is just to optimize the health of people across our state by developing and strengthening systems to expand access to primary care and other comprehensive primary care, including dental and mental health, particularly for populations of underserved people and areas that are underserved. So our goals are really to implement strategies for strengthening that delivery system of primary care, increasing the number of providers and services within underserved areas. And first, of course, in order to do that, we need to identify what areas are underserved. And then finally, supporting all of our partners across the state and providing technical assistance around things like data and information about loan repayment programs. So our core functions within the primary care office are to evaluate data and assist with the designation of federal shortage designations, including the health professional shortage areas, or HPSAs, and medically underserved areas or populations, MUAs and MUPs. I'll be talking more about HPSAs in particular today. We also administer the Arizona State Loan Repayment Program, which Edith will be talking about more later in the webinar, the J-1 Visa Program, and the National Interest Waiver Program. And then we also provide technical assistance and promote other federal programs that we don't administer directly. And that includes the National Health Service Corps Loan Repayment Program, Scholarship Program, and Nurse Corps Program. So now I'm going to just jump right into health professional shortage areas, or HPSAs. Many of you have probably heard my general talk about this before, but it's something that if you're not really working with day to day, it's easy to kind of forget how do those HPSA things work, and they definitely impact healthcare in rural areas in particular. So it is important to know. Please feel free to, as Jen said, type in any questions in the chat, and hopefully one of my colleagues can let me know if you have questions. I'm happy to stop and answer them. So a HPSA designation is meant to identify an area or a population as having a shortage of providers in either primary care, dental, or mental health. And really, ultimately, those designations are used to qualify areas for state and federal programs that are aimed at increasing primary care services, such as the loan repayment programs and National Health Service Corps. So this is a nice little graphic straight from HRSA. HRSA is the federal agency who actually designates the HPSAs. So as a state primary care office, we serve as partners to HRSA to make sure that we have all the updated data to them straight from the communities. So like I said, HPSAs can be within either of those three disciplines, and then it can also be either a geographic area, a special population group within a certain area, and typically that would be a low income population, or they can also be done for a facility, a specific facility type, and I'll explain that in a bit. So first we're going to focus on the area-based HPSAs, and later I'll get to the facilities. So for area-based HPSAs, there's geographic, which just is basically all the people in a certain boundary. There's geographic with high needs, which is the same, except now we classify that area as having, for example, particularly high poverty, over 20% poverty. And then it's a little easier, per se, to get the area designated. The threshold comes down a bit. There's also population type HPSAs. So typically we do that for a low income population, where we look at, just that lower income population in boundaries and just the providers that serve them. And then in a bit, I'll come back to the facilities, but some types of facilities, so are eligible for an automatic HPSA designation. That includes community health centers, FQHC lookalikes, rural health clinics, as long as they become National Health Service Corps certified first, which just basically means that they certify that they are using a sliding fee scale and accepting Medicaid. And also tribal and IHS sites. Now, for the geographic type HPSAs, we use boundaries that HRSA calls a rational service area plan, and we call our primary care areas in Arizona. So primary care areas are actually in our state rules, and they're based on demographic and care-seeking patterns. So we use those specific boundaries for all of our HPSAs, and that's kind of a plan that's pre-approved by HRSA. Now, in order to qualify as a HPSA for a geographic type, the population to provider ratio has to be at least 3,500 to 1 for primary care, and that's physician assistants, nurse practitioners, and it's only looking at family or general practice, internal medicine, pediatrics, and OBGYN. For dental, that ratio must be 5,000 to 1 or greater. And dental has kind of a unique calculation where it also incorporates the number of hygienists and assistants working with that dentist, and also the dentist's age. For mental health, we look at psychiatrists only, and the ratio must be 30,000 to 1 or greater. And when we're calculating these ratios, we exclude any providers that are obligated through federal programs such as National Health Service Corps, J-1 visa waiver, or federally commissioned officers. As I mentioned before, that primary care area, that's our plan that we use for all HPSAs, and those are just basically boundaries, right? So the state is broken up into 126 primary care areas. We really tried to make those areas conducive, the population size conducive to spatial and statistical analysis, because they are used throughout the Arizona Department of Health Services for other types of health data analysis and by other state agencies and other community partners as well. So as I mentioned, that establishment of primary care area boundaries is required by state statute. It's also the ultimate plan resulting from that is approved by HRSA for all of our federal shortage designations. So we always have to use those boundaries when we do HPSAs. And those boundaries were really made from a repeatable rule-based GIS methodology. So we made them probably in about 2013, I think, or so last. And the idea was that we would rerun that methodology every time a new decennial census comes out. So every 10 years, so that we can shift those boundaries as needed to reflect changing demographics, which is certainly an issue here in Arizona where some areas are growing very quickly. So we're actually coming up on that very soon. We'll be looking at that methodology in the next 6 months probably and rerunning it to see to update those boundaries for primary care areas. We do reflect always the tribal boundaries whenever possible, and also city, village, or planning boundaries. So for example, in the city of Phoenix, there are city villages, and we stayed true to those boundaries. Some other municipalities have similar type planning areas, and we tried to keep those. This is just a map of what our current primary care area boundaries are. Now, moving on to the next type of HPSA, geographic with high needs. This is the same as what I just explained for a geographic HPSA, except now that population in that primary care area is higher in poverty levels. So they have 20% or more of their population at the federal poverty line. And so instead of having to meet, for example, for primary care, that 3,500 to 1 ratio or greater, that ratio requirement is knocked down just a bit. So now it's 3,000 to 1. So it's just a way to kind of account for the extra needs in that community. So it's a little easier to qualify for a HPSA designation. The final type of area-based HPSA is a population HPSA. In Arizona, we've really only done this for low-income populations. In other states, they may do it for other types of populations. But here, for low-income, what we do is we look at just the population below 200% of the federal poverty line within that primary care area. And we look at just the providers that are seeing patients on access or a sliding fee scale. We do that by collecting access claims data and also getting the percent of patients using a sliding fee scale at community health centers through the data they submit, for example, and other types of safety net facilities. For example, if a provider, a doctor, let's say a primary care doctor, is working full-time and maybe half of their patients they see on access, we would count them as a half-time physician for the calculation of this type of ratio. And then again, there's the thresholds that the community must meet. So 3,000 to 1 population to provider ratio for primary care, 4,000 to 1 for dental, and 20,000 to 1 for mental health. So usually what I do when we're looking at HPSAs is I attempt to get a geographic HPSA for the community first. And if it doesn't qualify, then I look at whether it might qualify for that population low income type of HPSA. There are some areas, I used to say urban, as an example, urban areas have lots of providers typically, but maybe not so many who accept access. And so that area might not qualify for a geographic HPSA, but would for a low income population HPSA. Lately, I've been seeing this actually more in rural areas because the population size is so small. It's really a fine line. You know, if there's even one full-time provider or two full-time providers in some areas, that is over that geographic HPSA threshold. But when we look at the low income population, actually pull Medicaid claims data, oftentimes that area will qualify for this type of HPSA. I kind of talked about this already, but we exclude any providers who are already in obligated through federal programs. Also, if they're doing administration, we exclude that time. We don't count physicians who are inpatient or ER or urgent care. We exclude those who are at facilities that aren't open to the public, such as a VA, a university, military, and correctional institutions. Now, once an area has met that population to provider ratio threshold, the next step is to look at what HRSA calls contiguous areas. Basically, these are just all the surrounding areas within a kind of travel polygon that their system draws. So I have to show that all of those surrounding areas aren't viable alternate sources of care for this population. And I can rule out each of those surrounding areas by a number of reasons. One is that maybe that area is already designated as a HPSA itself or is overutilized, which is a greater than 2,000 to 1 ratio for primary care, for example. Maybe it's excessively distant, so it would take more than 30 minutes to drive there. Maybe there's significant socioeconomic differences in race, ethnicity, or even poverty that might make that population not feel comfortable going to that neighboring community for healthcare. Or it might be inaccessible for some other reason. One we have here a lot is that if it's a reservation, those services might only be available to tribal populations, so that isn't an alternate. So once we can rule out all the contiguous areas, then that application for HPSA designation goes to HRSA. Our project officer there reviews it and ultimately approves it, and it gets published on HRSA's website, and then once a year they publish all of them in the Federal Register. As part of that process of designating it, HRSA assigns a HPSA score. And this is what most of my questions come around is HPSA scoring. So the score is solely based on data. A lot of people ask me if I can get them a higher score, but really it's just what the data shows. So the higher the score, the higher the need in that community. All clinics and providers in a geographic or population HPSA have the same HPSA score and ID number. And so I'm going to show you these little graphics of what goes into it. So for a primary care HPSA, their score can be up to 25. Remember, higher is higher need. And the 4 items that go into that are the ratio we just talked about. There's kind of a scale that assigns points, so up to 10 points on that item. The percent of population that is below 100% of the federal poverty line, that up to 5 points. An infant health index, which is either infant mortality rate or low birth weight rate. And then finally, the travel time to NSC means nearest source of care. So the nearest source of care that isn't a HPSA and isn't overutilized. So sometimes there aren't any in the whole state, depending on the discipline. And so that would get a max of 5 points, but depending on the discipline, sometimes there might be one just right nearby. And then that would be a short distance and would get 0 or 1 points, for example. Now for dental, their score can go up to 26. The poverty and population to provider ratio and the travel time are the same, but the poverty is weighted a little more heavily in dental scoring. And then the 4th indicator for dental is actually water fluoridation status, and that looks at the percent of population that has access to fluoridated water. This has actually been a little bit of a sticking point for us lately. I'll talk about this in a moment, but I'm working on redoing a lot of dental applications because the data source we used wasn't accepted. So that is our project for the coming years, to really get that water fluoridation data set by primary care area so that we can have evidence for that in the HPSA score in the future. And for mental health, the score is out of 25. Again, we see the ratio, the poverty, the travel time. And here there's other indicators mixed in, the percent of population that is elderly or youth, and whether that primary care area is in the top quartile for alcohol abuse or substance abuse. Now, as I said, as a primary care office in the state, our role really is mostly to ensure that the provider data is accurate as possible. And the base data set that HPSA uses is NPI, which comes out of the Center for Medicare, I believe, and that gets loaded into HPSA's shortage designation management system. So that's kind of the base set. It's not terribly accurate, especially in a state like Arizona, where we have a lot of retirees, people moving in and out. So what we do as an office is we do phone surveys of every single provider on that list of many thousands. So as you can imagine, that takes quite a bit of time to do. We also request Medicaid claims data from Access, and we enter all of that updated data back into HPSA shortage designation management system. Then HPSA conducts something called the National Shortage Designation Update every 3 years. So this actually just happened in September of this year. And what that does is it basically updates scores for all existing HPSAs using all that current data. So HPSA has consistent data sets for poverty and things like that across the country, but it uses our provider data that we uploaded. And if the area no longer qualifies for designation, then it would be moved to propose for withdrawal. If it does, then it got a new score. In the meantime, our primary care office can continue to submit applications for new HPSAs, so areas that weren't previously designated but now qualify, or we can submit applications for rescoring of existing HPSAs if the data changes. And this happens sometimes in rural communities because, like I said, it really just takes one provider retiring to really shift that whole ratio quite a bit. So this shows the results of that most recent National Shortage Designation update. Now, I will say that this is something HPSA has been working on a long time. We used to, when I started doing this, we did these by paper, and then they moved to an electronic system. But as a primary care office, we were having to submit each application on our own and do the mapping in their system and everything. This was meant to really automate the process as much as possible, to do the whole country at one time. In theory, it was a very good idea, but there were a little bit of, as there often is with electronic systems like that, there were some kinks to work through. And so it ended up being a bit more manual than I was expecting. And I think many of our other state primary care offices were expecting. So what happened is, really, if anything on the map kind of changed a little bit, then the application had to be done manually, basically, to kind of put it in simple terms. So it ended up being quite a bit of work at the last minute on those that weren't qualifying just through that automatic run. So you're going to see as I go through these results that we still have quite a few pending. Primary care is pretty settled. So we ended up, out of 126 primary care areas in the state, we ended up with 5 high needs geographic HPSAs, 24 geographic, 50 low income population. And I will say that 18 of those were previously geographic. So you see how I had to shift them over to low income pop because they weren't qualifying anymore. And we just have 1 left pending. There were 8 proposed withdrawal, which just means that those areas were designated in the past, but did not qualify this time for either geographic or low income population. And then there's 38 primary care areas that weren't designated previously, but that I do have on my to-do list to assess with the new provider data that we've collected, just to see if they may qualify now with that new data. And so I'm shooting to have those assessments done by early 2022, and any that might qualify now, I will submit a new application for.
Tracy, you have a question in the chat.
Okay, I can't really see both because I'm running my
Yeah,
slides.
I can read it to you. It says, we noticed that many HPSAs were proposed for withdrawal in the recent HRSA update. Are those HPSAs being reviewed by your office for possible reinstatement? And I think this is related to primary care specifically.
Yeah, so that's what I'm going through right now. In primary care, there's not many proposed withdrawal anymore. There's only 8 like I have here. And so any in primary care specifically that are proposed withdrawal, it's because they didn't qualify again this time. That's different in the other disciplines. So I'm going to get to that in a moment.
Okay, and then there's one more question. Does the mental health category include waived opioid use disorder treatment providers? And then the second part of the question is, why is the age included in dentists but not in other areas?
That is a good question. I honestly don't know why they include age. It's just the federal regulations, which honestly are quite old for designations. They've, over the years, I have been doing this about 15 years, like Jen said, and over the years, it's been talked about many times, updating the rules around this federally, and it just has never happened. So I don't know why they included that. I mean, I think it's relevant for all providers, right? Because the older your providers are, obviously, the sooner they're probably going to retire, and that is all part of access in a community. So I don't know why they only included it for dentists. For the other question, when we do mental health HPSAs, we only look at psychiatrists to calculate that ratio. Now, that doesn't mean that that's all that matters. We know there are many other types of behavioral health providers, and there are many other types of behavioral health providers that are eligible for National Health Service Corps and loan repayment programs. And I'm sure Edith will talk some about that later, if they are located in a HPSA. But for the purposes of calculating the population to provider ratio, we only look at psychiatrists specifically.
Okay, and I think the other question I'll type in the box in the chat because it's more related to loan repayment.
Okay. So when all was said and done with the scores for primary care HPSAs, the average score of all our primary care areas was 15. It's a little higher for low income type HPSAs, 15.8 versus geographic, 14.7. And the average change in score overall from last time's HPSAs was actually quite a bit higher, over 3 points higher. So that is, I guess, good and bad news, depending how you look at it. Obviously, it's not good news that our areas are in higher need, but it does make areas, more areas eligible and competitive for loan repayment programs and things like that, that will help to get more providers to the areas needed. Now, dental is one that you will definitely see a lot of proposed withdrawal. As I said, there was, in addition to the other hangups, there was an issue with the water fluoridation data on this one. So it means I'm having to resubmit a lot of them. So right now we have 6 geo high needs HPSAs, 2 geographic HPSAs, 31 low income population HPSAs. There are 35 that are in process by me, and I hope to have them done by the end of November. And hopefully those will all get designated by the end of the year or so, probably early, maybe in 2022, once HRSA reviews them and publishes them. There are 11 that do not qualify this time that were previously designated. And we have 41 primary care areas that weren't designated before, but I am going to look at to see if they may qualify now. So of those that have gone through so far, the average score is 16, and that also is 2.5 points higher than previous HPSAs. So again, we saw the trend that the scores were higher this time. Low income population HPSA scores were a little higher than geographic scores. Now in mental health, this area, you'll also see some proposed withdrawals. Those have all been submitted, but they're just in the process of being reviewed by HRSA. And I think we should see those start coming in over the coming couple weeks, probably, hopefully anyway. So far we have 18 high needs HPSAs, 16 geographic, 7 low income population. We have 28 that are currently under review, 10 that will stay in proposed withdrawal because they don't qualify anymore. And then 47 that I will look at to see if they might be new HPSAs. For this one, the scores stayed up pretty consistent from the old scores. The average score is 16.3. Now, I'm going to try to go through this quickly so Edith has enough time. This is just about facility HPSAs. This gets kind of confusing to people. That area-based HPSAs, so what we just talked about, has to use the primary care area boundaries. We have to look at those ratios, eliminate contiguous areas. For the facility HPSAs, it only applies to that facility or organization. There's no requirements related to ratios or contiguous areas. It's just automatically applied to certain types of facilities. So community health centers, HPSAs, tribal, IHS, and rural health clinics. All of those automatic facility HPSA scores also were updated through this national shortage designation update process. And so you can see there, and I believe my slides will be shared with you all as well. So you can look at it more in depth later, but the average scores are quite high for the facilities. They're typically a little higher than the area-based HPSAs. And then Edith is going to talk a lot about the loan repayment program, so I'm not going to go too much into that. But just know that the HPSA designation is an eligibility requirement for National Health Service Corps, loan repayment and scholar program for our state loan repayment program, and also J1 visa waiver. Now, the scores are used as a way to prioritize awards for those loan repayment programs, National Health Service Corps loan repayment. However, National Health Service Corps in particular had a lot more funding this year, which is wonderful. And so whereas they used to run out of money, they kind of went in order of HPSA score, and they used to run out of money somewhere around like score 14 or so. They have a lot more money now. So their HPSA score really isn't as much of an issue for National Health Service Corps loan repayment anymore, as long as it's designated as a HPSA. So if you are a provider who would like to apply for a National Health Service Corps loan repayment, or you work with a provider who would like to apply, this is the year. They have lots of funds. For National Health Service Corps scholarship program, that's a little different, where the student, before medical school even commits to this, right? So when they get done with their schooling, in order to maintain that scholarship, they have to actually work in a HPSA with a certain score, and HRSA updates that each year based on their class year. So for 2022, you can see coming up, the score is going to be 20 for primary care physicians and nurse practitioners, 14 for PAs, and so on. HRSA has this really great tool that you can find your HPSA by. I encourage you to play around with it. You just enter the state, the county, the discipline, and then you want to make sure that designated is checked over there. And it'll come up with a list of all the areas, including facilities. If you want to find a facility HPSA score, this is the page you want to go to. You can also adjust it. So if you're looking for just HPSAs of certain scores, you can do that. Now, if you want to find, okay, is my site in a HPSA? This is the best tool to go to, find shortage areas by address. Note that this will not give you facility HPSAs, only those area-based geographic and population HPSAs. So you enter in your address and it spits out something like this that'll show you, is it in a dental HPSA, yes or no, mental health, yes or no, primary care, yes or no, and which HPSA it is, and the score and the last designation date. So for a rural health clinic or community health center, it gets kind of confusing because they can have one or two different primary care HPSAs because they might be located in a community that has a HPSA and they might have a facility HPSA. And same for dental and mental health. So that's a lot of different HPSAs to be working with. If they are in an area, for example, where the community is designated as a primary care HPSA, and they also have a facility HPSA score, then they should use whichever score is higher when they're applying for National Health Service Corps or State Loan Repayment Program. And that covers it. I want to make sure to give Edith time to get through her loan repayment program information, but feel free to email me if you have any questions. If you are unsure about your area's HPSA, I'm always happy to help you look that up as well.
Thanks, Tracy. Okay, so now that we know all about HPSAs, and I know HPSAs are confusing, I'm still getting used to them, but now you know that if you qualify and you're in a HPSA, you can potentially be eligible for loan repayment. So if you're a rural health clinic or anything like that, your staff and people who work for you are eligible. So I'm going to go through some of the programs, both the state and the federal programs. So first I'm going to go over the state program, and that program is administered through our office. And so it's the Arizona State Loan Repayment Program. We call it SLRP. And the goal of the program is to recruit and retain providers in rural and underserved areas, and thus increasing access to primary dental and mental health services. So it's modeled after the National Health Service Corps, and I'll point out the differences, but really, you know, our programs are similar. So I know there was a question earlier about if you can apply to both. And we do encourage people to apply to both. When the National Health Service Corps didn't have a lot of funding, you know, people would apply to both, and depending on which one they received, they get to choose. But you can apply to both, but you can only be obligated to one at a time. So both programs require a 2-year obligation. So within those 2 years, you can only be obligated to one. So if you finish your service for one and you decide to transition to the other, you can do that at different times, but not at the same time. So this is just some data from surveys that we give out to our participants. So for SLRP, we do see that in people in rural practice, it does have some retention. So when asked to the SLRP providers how many more years they anticipate remaining in their practice, in rural practice, they said 14.1 years. And that was the average, and then the median was 10 years. So it is a great retention tool and something to think about considering. So eligible disciplines, similar to NHSC, it's primary care dentists, physicians, dentists, pharmacists, advanced care providers, which include physician assistants, nurse practitioner, and certified midwives, and then behavioral health providers, licensed clinic social workers, licensed family and marriage therapist, psychologists, and licensed professional counselors are eligible for the state loan repayment program. So one thing that the state loan repayment program is different is that dentists and physicians have the possibility of having a little bit more in their award. So the average, the maximum amount for 2 years, if you have a HPSA score of 18 or above, for a full-time commitment would be 65 for physician and dentist. And then all other providers is up to 50,000. And one thing to note is that these awards are tax exempt. For the state loan repayment program, we do pay your lender directly on a quarterly basis. So that's the state loan repayment program. And then like Tracy was talking about priority, these are the 10 factors that, SLRP applicants are scored against. Being rural versus urban, or rural gets more points, the HPSA, and all of these different items, we score against. So based off that, we rank applicants, and then we provide funding to as many as we can in order of the ranking. So for the cycle for SLRP is January, we're going to open up the site registration. So sites must register. So if you're a site and you are eligible, you have a HPSA in your primary care organization or the clinic, you can be eligible. And so in January, we invite you to apply so that, your staff members can apply in April when the cycle becomes open. So in January, sites must register, and then April, first is the first application cycle, and that's really for people who are finishing their initial 2 years and going on for a third. But then the real initial application for anybody who's new and it hasn't been part of SLRP is mid-April. So we open it up 45 days before June 1st. So it will open up, and June 1st is the deadline for anybody who wants to join SLRP as an initial applicant. And then we get all applications by June 1st, and then October is when, awards will start and contracts are awarded to applicants. So Arizona has been recognized as part of their SLRP program, has been recognized because we have been able to increase funding and getting different kinds of funding. So there is currently a state match required for the program, and we were able to get other sources of funding, like donations from private organizations and things like that. And we were also one of the states that were able to increase our budget and increase participation in the program. So the program has been successful over the years and has grown a lot since its beginning. So we provide outreach to different schools in Arizona, dental, medical, and other health profession schools, to conferences and professional organizations. So if you are interested in having a presentation about the state loan repayment program or any of the primary care office programs, we're happy to do that and increase outreach. This year, state funding actually has in statute that we need to increase participation by behavioral and mental health providers. So we are looking for ideas in ways to, bring that more behavioral health professionals into the program. I think historically they weren't initially part of the eligible disciplines, but now they are. So we want to make sure we're providing outreach. So if you have any ideas, feel free to reach out to me and let me know, oh, you should really present here, and put me in contact. Or if you want someone to present to your clinic, telling them about, potentially you're eligible for this program and the requirements, feel free to reach out. So one of the things, like I talked about earlier, you can donate directly to the program. You can donate for a specific discipline or county. So if you're interested in donating to the state loan repayment program, let me know. My contact information is here, and these slides will be sent out. So this is our website for the Arizona State Loan Repayment Program. So now I'm going to go talk about the National Health Service Corps Loan Repayment Program. Currently, there's an open cycle. This is a cycle that's out of cycle. It opened last week and is open till December 21st. And National Health Service Corps has a historic increased amount of funding. So they are funding lower HPSAs than prior years, like Tracy mentioned. So if you are an NHSC site or you work in one, I strongly encourage you to apply for a loan repayment program because they do have historic levels of funding this year. So the NHSC loan repayment program is evolving. typically this first program is the one that historically has been, I think 50 years now they've had this program, but now there's 2 other programs, and you would use one application and you can apply to both, to all 3, but you would use the same application, but you can only apply to one program. So depending on, what type of site, so the original, the old, the NHSC loan repayment program, that's, the basic one that's always been around is $50,000 for 2-year commitment at any NHSC approved site. But then there's the NHSC substance use disorder workforce loan repayment program, and that's a 3-year commitment and up to $75,000 for full-time. And this has to be an NHSC approved substance use disorder site. And then there's the rural community loan repayment program, and that's also a 3-year commitment up to $100,000 for full-time. And then it has to be a rural NHSC approved substance use disorder program. So these programs all have, a little bit different eligible disciplines and those who are eligible to apply. I'm going to go through quickly just the 50,000 one and those requirements. So for NHSC, these are the disciplines similar to SLRP. You have to be a U.S. citizen licensed in the state where your employer is located, except IHS sites. You're eligible as long as you're licensed in the states. You have to have loans for school, and you have to be in one of the NHSC approved sites. And so this program is a little different than the SLRP program, where it's a lump sum. So you get a lump sum up front for your 2-year commitment, and the maximum for loan repayment with NHSC is $50,000 for full-time, and these are also tax exempt awards. And then up to $30,000 for a HPSA 13 or below. So the amounts are a little bit different. So if you would want to apply to both and then see which one you're eligible for, which one gives you a little bit more, you would just choose one for your obligation at a time. And then NHSC, you're able to extend and apply for extension for another year until you pay off all your qualifying loans. So these are the site eligibility. The eligible sites. So FQHCs, rural health clinics, IHS sites, solo group practice, so any primary care location, and then they have to be in the HPSA, except Medicare and Medicaid, use sliding fee scale, except IHS sites are exempt, have a non-discriminatory policy, maintain competitive salary and benefits, and must be NHSC certified for you to apply. So this is the website for NHSC. And currently there is also another loan repayment program that is open. It's the Nurse Core Loan Repayment Program, and it's open from now to January 13th, 2022. So this program is a little bit different. This is only for nurses, and it can be any type of nurse that has a diploma. It can be an associate's, bachelor's, master's, or doctoral degree, have an unrestricted RN license to practice in the state, have outstanding nurse education loans, and be employed full-time, which for nursing is 32 hours per week. And it has to be in a critical shortage facility or a school of nursing. So nurses can receive up to 60% of their current outstanding qualifying educational loan balances for 2 years service. And then after that, they will be eligible for an additional 25% for a third year of service. And this loan repayment program is subject to federal taxes. So you will be taxed on Nurse Corps Loan Repayment Program funds. So critical shortage facility is located in a primary or mental health HPSA, like Tracy was talking about earlier, and must be a nonprofit located in one of the states. And these are some of the eligible facility types. And then for nursing, you can also be nurse faculty at a private or nonprofit school of nursing that trains nurses or NPs. So for, like we talked about, is 32 hours for, that's considered full-time for nursing, and 45 weeks per year. So that's the Nurse Corps Loan Repayment Program. This is the HPSA website. I encourage you to, sign up for their updates. Like they've had cycles that are out of the norm, and they have different announcements. So if you are a site point of contact or you're a provider who can potentially be eligible, I encourage you to sign up for their updates so you can see when the next cycle is open for any of the programs you might be eligible for. So this is just the contact information for our office. And if you have any questions, I think there might be a question in the chat.
Yes, Edith, it was asked for NHSC employers have to first apply as a site before the provider can apply. Is the same for state loan repayment program?
Yes. So NHSC, the site certification typically opens in the summer months, and first slurp it'll open up in January. So yeah, in January the site must be eligible, must sign up and be eligible, and then in April the application will open so people can apply. So yes, they do have to be registered sites for each of the programs before a provider can apply.
And then there was, for SLRP, do we just go to your website? Yes.
Yes.
The link on our website, yes, for applying as a site. And then there were just some suggestions, I think, of getting the word out to behavioral health providers, which is great. ASU College of Health Solutions has a master's and doctorate behavioral health program. ASU School of Social Work, U of A medical nursing students interested in psychiatric care or related, and UA addiction fellowship.
Thank you. Well, I'll
Good ideas.
Yeah, thank you. Thank you, Bridget. Are there any other questions? Or
while we're taking a moment just to see if there are any other questions, I just want to acknowledge your work. I think that everyone can see how apparent it is the skills that are needed to really process and maintain these programs to the benefit of the entire state. So thank you so much for everything that you do and your diligence. I do see one more question coming in. Are there limitations to the number of loan repayment programs that we can apply for at one time?
No, but the limitation is that you can only be obligated to one at a time. So, right now there's multiple NHSC cycles, so you can't really apply to SLRP right now because our cycle isn't open. But if, in the summer cycle, it typically is overlapping, so you can apply to both. The limitation is that you can't be obligated to both at the same time.
Great. A comment This is a very overwhelming amount of detail, that's for sure. Is an individual able to contact anyone to discuss their case, what they may be eligible for? For example, I'm an RN with student loans, but soon to graduate as an AP RN with those loans as well. Is there any kind of case consulting for individuals with their, or what would your recommendation be?
Yeah, so you know, you're more than welcome to call our office, and we're available to answer any questions. Like Tracy said about HPSAs, we talk to people all the time about I'm working at this site, is this eligible, or this is my situation, I'm like graduating, what am I eligible for? So yeah, we're happy to talk to you and kind of give you all the links and walk you through some of those, and you can ask us questions. And if we don't have the answer for NHSC, we're happy to put you in contact with our state liaison for NHSC as well. So we can try to kind of guide you and give you the resources to understand, which ones might be the best for you, or, kind of talk through what the requirements and the information that we have. And if we can't get you the answer, we'll work to get you the right person.
Yeah, I'll underscore, this is our primary care office group at the Bureau of Health Systems Development at the State Health Department is one of the most helpful and supportive groups at troubleshooting all kinds of the unique situations across the state. I'm thinking also that in terms of health professional recent graduates, that there are advising programs at the various health profession schools that can also do some really good supportive triage work and help guide people as well. So sort of an all hands on deck, because the important thing is to try to get people into the areas that need health professionals and make that sustainable for them too. Because I think we all are well aware that the needs are really great and have been made even more great over the past 18 months of the pandemic. So with that, I think we're closing on our time. Would you all like to have any last remarks before we close the webinar today?
No, I just Tracy mentioned it, and I just want to reiterate that our office, is here as a resource. And if you have any questions or, need any guidance on HPSAs, loan repayment, or any of the programs, feel free to reach out.
Thank you so much. And also feel free to reach out to the Arizona Center for Rural Health as well. And we are also able to field questions and match you with the appropriate supports as best as we can, and with the help of our partners. So thank you, everyone. And one more question about the slides for the presentation. Yes, there's great detail on the slides. So by the end of the business day today, we'll have PDF versions of the slides available on our website. And the recording usually is available within a day or two. Thanks, everybody.
Thanks.
Thank you.